How are you?
Okay. Ask me in about an hour.
Yeah, I'll end it right away. Yeah. Right, thanks. We're good? Okay. Right, thanks.
Just before we get started, if you could put your mics on mute, I think it would help in terms of the sound audio. And if you want to say something, just raise your hand or unmute your mic. But this way, I think we'll have a little better audio capture.
All right, Dr. Warner, we're all set. You can call the meeting to order.
Okay. I'm going to call the October 8th, 2012 Board of Health meeting to order. And before we do any business, I want to remind everybody that this is being recorded and it should be available on YouTube. I know that was a benefit for people who could not attend last month's meeting. And so again, thanks to Bruce and the village for providing that service. And before we get started, I'm going to read a statement. This is required. Until further notice, meetings of the Board of Health will be held electronically, with a majority of members participating via remote access in order to comply with the State of Illinois Gubernatorial Disaster Proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Bruce A. Jones with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to citizencomments@skokie.org, by mail to Village of Skokie, attention Bruce A. Jones, Interim Director of Health, 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village's Dropbox located by the public entry to the Village Hall. So with that, we are in order, and we are going to approve the minutes in the agenda, the minutes of the last meeting in the agenda by consent. So unless somebody has an item to extract and discuss, we'll accept these minutes.
Can I say something? On the second page of the meeting page, there's something misunderstanding. Ongoing project in the last sentence, the first program was held or will be held on September 9 or 19. If it's 9, then we put a change the word. Because we had a meeting on 11, 10.
Oh, I'm going, okay. So that needs to be amended to well, that was a program though. I don't know if that wasn't the Board of Health meeting though, Bruce, was it? The
I'm
projects?
looking at the minutes. Are you speaking about the foundation
Ongoing project, the last sentence.
on the second page?
Yeah, second page, in the bottom.
No, that actually was held on the day before of our Board of Health. Yeah, it was just a highlight.
Oh.
There was one of the projects, but it was held the day before the Board of Health. Yes.
So was held,
Yes.
not be held on. Okay.
Correct.
That's how it.
No, thank you.
All right, thank you all. And Bruce, the next is an update on the COVID-19 and flu.
Okay, well, Sue is not with us tonight. I apologize. She needed a couple well-deserved days off right now during the COVID and flu program we're having. So as far as COVID, we're staying very steady here in Skokie. Our positivity rate over the last 2 weeks has been at 3%, which I think is very good compared to overall Cook County, which obviously we're in their aggregate data. Right now, they're at 5%. So I think everybody in Skokie is doing a good job, from the businesses and our residents and everybody involved. I don't have anything more specific on that other than Dr. Werner, would you like me to pull up that document that you sent to me at this point in time for discussion, or you want to wait till later on?
I'll wait till a little later on under my report.
Okay. And as far as flu, we held our first flu clinic, and that's in the monthly report also, but we held our first flu clinic on September 30th over at Oakton Park. It was very well received. we obviously had to change things around quite a bit because in the past we would run over 250 people through in an hour over a 4-hour period. This year we had to stretch that out because of COVID into 100 appointments every hour. But the flow worked very well, and at that first clinic we vaccinated 844 residents. So that's my quick COVID and flu update right now, if anybody has any questions.
Any questions? I just have a question in terms of the contact tracer. There was mention that there were hires that were being planned. Have those been completed for the department?
All our hires that we had planned are in place right now. We are looking at the budget, and if we can, we do have the ability to bring more people on board if necessary, but we're watching our budget these first couple months just to see how we're doing.
Sure. And is point of care testing going on at the long-term care facilities?
From what I understand, they have been receiving some of the point of care testing materials, and the nurses have been involved with that, and obviously they're reporting on those issues. So, but that's part of the data that we're trying to glean out of our system. So
that was my question. If that data is included in the overall statistics for the village?
Some of it is. David Clough, who is our data analyst, as you know, he unfortunately, his last day was with us yesterday, so we've also lost him. So I'm wearing that data hat also. But some of that data does get gleaned out because there's a lot of duplicates. Maybe Dr. Vernon could speak to this even more at the state level. Because you're getting people tested in the same long-term care facilities every week, and the data is going in, and some of the departments are looking at it differently because that can skew your positivity rates.
Dr. Vernon, any comment on that?
Sorry, I was just trying to unmute myself. I think I got it done successfully.
Yeah.
Yes, we're aware of the number of duplicates because of the serial testing format that's being conducted in the long-term care facilities. So the state says that each result has to be reported, but they are doing some deduplication at their end so that those individuals are not counted multiple times, and they could, somewhat like deflate the positivity rate in those settings. So Bruce, if you have any special needs in terms of data management, perhaps you and I can talk offline, and I can link you with people at the state who could provide you with better instructions and guidance.
Sure, not a problem. I appreciate that.
All right, anything else, Bruce, from the COVID and flu?
No, I apologize. My report is brief tonight, but that's...
Brief and to the point. As far as my report is concerned, can you pull up that slide?
Sure, give me one moment. Let me share it here.
One issue that's being discussed in the public health community is the equitable distribution of a COVID vaccine if one is developed that is safe and effective. And the CDC and the FDA tasked the National Academy of Medicine to come up with a framework for distribution of the COVID vaccine so that it would be equitably distributed across the population. And I was on a conference call earlier this week in terms of what the Academy has come up with. And I thought you might be interested in just seeing how this is being ranked. Now, whether or not we're actually going to follow this, we don't know. But this is what has been proposed. And I think it may give us some direction in terms of if we do get a vaccine, how we could go about getting this distributed to the community. So the Academy looked at what is risk, and it divided everything into phases. So the first phase, the first part of it, 1A, will represent about 5% of the population, and that is the frontline health workers, the ambulance drivers, the cleaners, and first responders, particularly those critical care healthcare workers. In phase B, would be for those with underlying conditions that put them at significantly higher risk. And we've seen those defined in terms of various underlying conditions such as immune deficiency, cancers, and so on. Those with 2 or more chronic conditions and 65-year-old and older living in group living facilities. So that would be the first phase. Phase 2, which would represent anywhere from 30 to 35% of the population, would look at critical workers in high-risk situations, teachers and childcare workers. I thought that was very interesting in terms of how we're going to get our kids back in school and how childcare is going to be provided for the people that are staying at home right now, taking care of their kids. Also, those with an underlying condition that puts them at moderately higher risk, and all people under 65 who are in prisons, jails, and detention centers. And again, we know that the jails and the prisons have been a hotspot, particularly the county jail here in the Chicago area. Next, phase 3 would be young adults and children, if safe for them, and people who work in industries. And that would be anywhere from 40 to 45%. These would be folks who have contact with the public, such as hotels, banks, higher education, factories. There's also phase 4, and that is about 5 to 15%, and that represents everybody else who's not been vaccinated. So this would be a rollout of the vaccine, and like I said, it's based on risk. I thought you might be interested in seeing that and be open to any kind of questions. I am not an expert on this. Like I said, I just said it on a call, but I thought you would be interested.
I think this puts it in good perspective on what we think should be done, actually.
Yeah. I know Bruce and Sue and myself had a little discussion last month in terms of, how would this be distributed in the village, and this gives us structure at least to start thinking about that. So it's not a free-for-all, but it would be very deliberate in the way it would be rolled out.
Dr. Werner?
Yes, Dr. Ernan.
Hi, this is Mike. If I might just make a comment, the state has a working group together, and I'm sitting on that task force looking at the plan for vaccine distribution. If and when the vaccine becomes available, well, if it's not if, it's when. And they do have a plan, which is very well structured, actually, in terms of receipt and management of vaccine from the federal government, and then the distribution to the local health jurisdictions. And also, they have plans for how the vaccine should be administered, and also how it will be recorded. So all of this information will be placed in iCare, which Bruce is quite familiar with that system, whereby all vaccines are registered in that central depository, and there's provision for recording the COVID-19 vaccine in that system as well. There are thoughts right now that it could be 2 doses required. We don't know as yet. This all depends on the type of vaccine that is ultimately approved by the FDA for distribution to the public. And the time period that they're looking at right now is 3 weeks from the first to the second dose.
And operationally, there are issues in terms of just getting the vaccine distributed. I saw an article that the cargo airlines are wondering how they're going to be able to handle the load. And there's issues we talked about last time, like cold chain. If this requires very cold refrigeration. So many things to be worked out, but at least people are working on it. And thank you, Dr. Vernon, that we on the state level are addressing this as well. So, any other questions or comments? Bruce, you can go ahead and take that down.
Okay, let me do that.
Okay. There was mention in last month's report from Human Services about supporting people that have issues with rent. Since then, the CDC has issued an eviction moratorium. Is that going to have much of an impact on terms of the Health and Human Services with their support for people who can't afford their rent?
I know our Human Services, the Brian McHugh, who now is the interim, or has stepped into the place right now for Beth Lindley, who has also left us the Health and Human Services Director. That's part of my monthly report. He's the point person now handling all that. So we're not quite sure how that will impact our Skokie residents, because we'll have to take a look. We'll have to dive into that data and see exactly how many people will potentially impact in Skokie. But they are aware of that, and they're looking at that closely.
Thank you. A couple things to remind you of. First of all, vote. If you haven't filled out your census, fill that out and get a flu shot. These are all very important things that we need to get done in the next few weeks. Also, there are questions coming up about how to safely celebrate Halloween. And I was very pleased that the most recent issue of Skokie News has some recommendations, again, based on CDC guidelines in terms of how to safely celebrate Halloween. And if there are going to be celebrations, how to address those in terms of crowd size, and if kids are going to go trick-or-treating, how to approach that. So if friends and neighbors ask you, well, what are we going to do for Halloween, you can refer them to that issue of the Skokie News, and you can reach it very easily online.
Dr. Werner, this is Mike.
Yes.
May I comment on that as well? The state has issued guidance on Halloween and how it can be safely conducted. And it was very well done, actually. I can send that to Bruce for distribution to the group. It is very detailed and very thorough. And on the heels of that, we're also hoping to issue guidance for general holiday celebrations, which are coming up, Thanksgiving and Christmas, for people to, if they're going to be gathering together as family groups, that it be done in the safest possible manner.
No, that would be wonderful if that could be distributed.
Yes,
I know people are having this whole pandemic fatigue, and I think that's beginning to break down some of the guidelines that we've been following. So if we could get that distributed, that would be great for the holidays coming up.
Sure, not a problem. I did receive that, Dr. Vernon, through Siren.
Excellent.
I believe also, Dr. Warner, I apologize, I didn't want to interrupt, but on our website, the COVID website has that. We were initially put out the CDC guidance because we were waiting on the state guidance to be produced, because obviously they wanted to take a really close look at it, and they did a great job. But there also should be a link to that same state guidance on our website, but I will forward that out to the group.
Great, thank you. Finally, if you have any comments on this current format, how it's working, if you have issues, please let me or Bruce know so we can improve this. I think we're looking at this for the foreseeable future, and I want this to be useful for you in that we make the best use of our time. So please let us know if there are any issues that you want to address. And with that, the director's monthly report.
Okay, well, I touched on a few things already, but I'll just hit the highlights. So, best wishes for Beth Lindley, the Human Services Director for the village. Beth Lindley has taken a position as the Director of Kinship Care Resource Center with the Michigan State University School of Social Work. Her last day with the village was September 11th. We thanked her for her leadership, wished her well in a new chapter of her career. As such, myself, Bruce Jones, Environmental Supervisor, will now serve as the Interim Director of Health and Human Services. We touched already on our community shot flu program, so I won't repeat that. Some of our ongoing projects, we had the Human Services staff reach out to the ELL Parent Center workshop here in Skokie. They held 3 training workshops that took place in September by Zoom. The 3 workshops were provided in 3 different languages, Arabic, English, and Spanish, to accommodate all the participants. The objectives of the workshop were to explain the Village of Human Services mission and the services provided to residents. The participants were explained how they can access all our services, and we had 53 participants, which included 38 English participants, 5 Spanish, and 10 Arabic participants, so it was well received. Also, what's going on right now is our Senior Health Insurance Program, or the SHIP program as it's known. The Open Enrollment Part D Toolkit was released at the end of September to start preparing for the Part D Open Enrollment, which will range between October 15th to December 7th. We've held that program here in the Village Hall for quite some time. We will be reaching out to all our SHIP volunteers to see how to best move forward with the open enrollment this year during COVID. There will be an online Part D sign-up assistance event hosted by the Skokie Library. That will occur on Wednesday, November 11th from 9 a.m. to 4 p.m. And those are my basic highlights.
Any questions for Bruce? Nikki, Dr. Eckler, unmute yourself.
You need to
Unmute
unmute.
yourself.
Muting. I have a question. Where did David Clough go?
So David Clough took a position with School District 69. And I don't know all the intricate details of his new position, but I'm sure it will be heavily involved with data management, data tracking for the school district.
I wish him the best of luck. He was terrific.
We all did, and we'll miss him greatly, obviously, because he was a great asset here, tracking all our data. I can say that one of the things that we were able to establish before David left, and I'll give him all the credit, is when you go to the Skokie's website now, the COVID Skokie website, all those graphs and data links are now being supplied through what's called Tableau. It's a intricate system that basically ties into the back end of your data streaming system and creates those, and they're up to date daily, but in one day in the rear. So if you were to go to the site today, all those graphs are current up to yesterday's data. And he was able to get that done before he left, so that was a great help.
With nothing else from the director's report, old business. At the last meeting, we discussed the flavored vaping issue. And in talking with Bruce about how to handle that, we don't make policy, we don't make procedure. That is something that we would recommend to the mayor and to the village trustees. And so based on, I think it was 2005, Dr. Drackler and Dr. Williams composed a letter to the mayor dealing with the tobacco 21 issue. And that was developed into the ordinance that exists today. And so the path that we're going to take is to write a letter to the mayor, and Dr. Williams has offered to put a draft together. I don't think Dr. Williams is with us this evening, but he's sort of our resident expert on all things vaping and tobacco. And so we're going to get that letter together and sent off to the mayor. Any discussion about that? And
Well, that was my intention actually, that was my intention to send this request to our mayor like we did the last time, because we have a care committee, we like to look into it and refer to the mayor, and mayor have to work it out.
Yeah.
And Dr. Russell can be the one, if he can put something in there, I'll appreciate it.
yeah, and we'll get that letter put together and sent off.
Thank you very much.
Wanted to give you a follow-up on that.
No problem. Thank you.
And the second thing, last time we talked about bicycle safety and helmet wearing. And talking with Dr. Lynn about this, what we may do is put together a public service announcement that we could put into the Skokie News and just to remind folks that it's important, especially children, to use their helmets. Now we're going into the colder weather, so we may not have as much bike riding going on, but we can anticipate that May is going to be Bike Safety Month, and we can put together a campaign to roll out in the spring, and it may incorporate some of the things that we talked about last time in terms of working with the local bike shops and so on to see if we can get some sort of a discount or whatever on bike helmets. So any other comment about that issue? Is there any other old business for us?
I think on the Hamlet issue, I would suggest we should form a mini committee, like a 3-member, and they will follow up with the mayor office or somebody who would pertain to do something to get into it. It was just talking from the little committee, and let's go how the procedure proceed and come up with something.
Yeah, we could put the public service announcement together, and then we can work toward the May target to make sure that we have a plan that is going to be acceptable and we can get rolled out in timely fashion. Any other old business? Is there any new business for this evening?
Well, I know, I'm sorry, I'm keep talking, in the old business, we used to planning to have a garbage can, like a recycle. We have a lot of recycle now, more than the regular garbage. So we were thinking to switch over, make a small container of the regular garbage and make a bigger container for our recycle bin. And this is one of the issues. The other issue was we are working in the past with the restaurant, other people, they should be able to sort it out, the regular garbage and the recycled one. So I don't know how far we are in there. If we done, I think that'd be good help for our village and the service to the community.
You know, I know it's been several months since we've been able to get together, and so some of these things we need to be reminded of. So thank you about that.
Yeah.
And the other aspect of this, especially with the restaurants, they're struggling right now, and so another thing to consider is another expense for them.
Yeah, that's true.
Yeah, there are many dimensions to look at.
Well, this is a good time to do something. Maybe if Skokie come up with some incentive for them, something, the way the norm is better, I think it'll be done. Sometimes it helps, and the people are in need of this kind of safety. Any safety will be helpful, and other way around.
Sure.
So we can proceed, and at least.
Dr. Dreckler? Dr. Dreckler?
For 20 years, I've been trying to get the businesses in Skokie to recycle. And my comment was always, because you said they're struggling, in Highland Park, you pay a set fee. If you recycle, you pay nothing. You only pay if you have landfill. This had been brought up many times, and nobody wanted to listen. So if you're struggling and you're recycling and you don't have to pay for the recycling, instead of going into a store, for example, Kaufman's, I would always ask her, where's the recycling? Oh, we can't afford recycling. But the system is based upon not having to pay if you recycle. You only have to pay, you pay, $1 extra, you pay a certain amount, you set the amount that you pay. You pay $1 extra if you have landfill, and you don't pay anything for recycling. That should diminish some of the cost of garbage if you set up the right way of doing it that's agreeable. But that was one of the projects that I never able to get done during my 20 years on the board and 10 as the chairman. So it'll always be a problem. I don't know if Bruce has anything to say about it, but that was how I approached it to the village, was don't pay if you recycle. Pay a set amount, don't pay if you have to recycle. You'd be amazing how many things you recycle to not have to pay for landfill. Thank you very much.
Yeah, thank you for reminding us of that. The carrot and the stick approach, the carrot usually wins. Yeah. Bruce, perhaps we can discuss offline how we could advance that as well.
Sure. I mean, I know Dr. Dreckler has brought that up many times, and we've even had the Public Works Department here to speak before the board on that very similar topic. I could reach out to them and see if they've got any new data. I mean, the only data that they might be able to capture right now is in the residential districts, which is being captured more obviously there by our refuse people that are picking up our refuse and our recycling. The commercial aspect, as we've spoken before, is handled through a contractual business through Lakeshore Garbage and Recycling. Every business has the ability to get a 95-gallon toter free of charge for recycling. That may not be enough in some of these businesses, but after that, then yes, they do have to pay for recycling, but the hope is that by paying for recycling, that will lessen the other waste stream of the garbage, and they could reduce the frequency of their pickup there. So it could possibly be a win-win, but they would have to buy into that.
Yeah.
And that's the difficult part.
Okay. Thank you. Well, we'll follow up on that. Any other new business for this evening? Well, seeing none, I think we're at the end of our agenda. Any comments?
I need to look at the citizens' comments on the computer at the back of the room just to see if anything's been asked, and so if I could do that real quickly.
Sure.
Hold on.
This is part of the open meetings requirement that citizen input be available and commented on. It's too early to have a Bears score. Dr. Lynn saying no.
It's being delayed broadcast in my house.
There is nothing on the citizens' comments on the in the system.
Well, if there's nothing else, then I ask.
Move to close?
I'm sorry?
Okay, we can move to close?
We can move to close. You make a
Yeah.
motion? All right.
That's it?
Okay.
Any objections to adjournment?
Have a safe Halloween.
All right, we're adjourned.
All right, thank you, everyone. Stay safe.
Okay, thank you. See you next month.
Take care.